Hello, I'd like to welcome everyone to today's webinar that is hosted by the Canadian Veterinary Medical Association. The focus of today is a demonstration and discussion of Firstline, which is a handheld app that will serve as a user-friendly platform at point of care for the revised CVMA Guidelines for Veterinary Antimicrobial Use, or AMU. My name is James Dunlop. I'm currently the Deputy Project Manager of this ongoing Stewardship of Antimicrobials by Veterinarians Initiative, or SAVI. Before we begin, I'd just like to acknowledge the immense and ongoing effort currently underway on the part of our veterinary colleagues and their clients in British Columbia in the face of an historic environmental disaster. We are once again reminded of the critical role that the veterinary sector plays in collaboration with producers, the agricultural industry, and government in addressing animal health and welfare challenges that can arise at a moment's notice. As we are currently in World Antimicrobial Awareness Week, the One Health challenge that we are discussing today is that of antimicrobial resistance and antimicrobial use, and efforts to ensure the long-term efficacy of antimicrobials for both humans and animals. We are privileged to have one of our subject matter experts here today, who helped lead both the 2018 and 2021 revisions of the CVMA Guidelines, and who will be providing insight from the dairy perspective. Since 2008, the guidelines have served as a decision-making support resource for veterinarians, veterinary technicians, and vet students to obtain the latest information on recommended antimicrobial treatments, as well as pathogen and drug information. Following a presentation and demonstration of the Firstline app by Dr. Murray Gillies, I'll be providing a brief summary of key points prior to a Q&A session where the audience will be able to submit questions and comments via the Zoom chat function. This webinar is scheduled for a maximum of 1 hour, depending on the number of questions and the length of the discussion. The webinar will also be recorded and hosted on the savvi.vet website so as to allow individuals who are unable to make today's session to view it later. So without further ado, I'd like to pass the torch over to Dr. Murray Gillies. Dr. Gillies grew up on a family-run dairy farm in Sussex, New Brunswick, before completing his Doctor of Veterinary Medicine degree at the Atlantic Veterinary College. Following graduation, he spent 2 years in New Zealand in a dairy-focused clinic before working for the government of New Brunswick for 5 years in large animal practice. He joined Vetoquinol Canada as a technical services vet in September of 2018. He's also past president of the Canadian Association of Bovine Veterinarians and the current District 12 Director of the American Association of Bovine Practitioners. He's also a member of the Canadian Animal Health Surveillance System, the Canadian Antimicrobial Network, and just recently initiated a master's degree in health management and public health at ABC with a focus on antimicrobial use in dairy farms. He remains very active in the day-to-day operations of his family dairy farm, where they've implemented many SAVI recommendations and guidelines successfully, including 0-0 calf care, selective dry cow therapy, and the use of prudent use guidelines when necessary. So take it away, Murray.
Right, thanks very much, James. I just want to start very briefly in this presentation before I get into the demo of the app. I want to take the first 5 minutes or so to get people motivated and excited about antimicrobial prudent use in the Prudent Use Guidelines, because if people aren't motivated and excited about something, we can't really drive change as human beings. And I think the ultimate goal of these Prudent Use Guidelines is to actually drive change among the veterinary sector. And so, I'm not going to harp on about why prudent use is important or whatever, but I am going to start with that. Why do we even care about prudent use? And to me, there's three main reasons. It's for our profession, for animal welfare, and for One Health. And if you'll notice on James's SAVI slides later on, you'll see the catchphrase, professionals looking after their profession. And that's really critical to me. Our profession needs to take charge of this and use antimicrobials properly so that we can continue to do so as a profession. And we have seen instances where antimicrobial use has been restricted among veterinarians by government, certainly the Category 1 issue in Quebec, restrictions in Europe and whatnot. Obviously, we want to treat animals properly, give them the best chance to cure. And finally, we do care about a One Health perspective. We want to limit resistance, and we want to safeguard our food supply. On the food animal side, which is the focus of today's talk, these products are ultimately essential to produce good protein, good food. So we want to safeguard that food supply, or otherwise, without food, we might have other issues going on. Just really quickly to highlight a few of the major pathogens that the world governments and stuff are looking at as far as resistance goes. I want to point out a few of them that are veterinary related. Now, obviously, a lot of these urgent threat ones are hospital driven. infections, and then we've got good old gonorrhea, which we'll talk about in a little bit. But we've also got drug-resistant Campylobacter, drug-resistant Salmonella, and if we go to the WHO list, which is a little more refined, again, we see most of these hospital-driven infections. But down here in the high priority list, we've got fluoroquinolone, specifically fluoroquinolone-resistant Campylobacter, significant risk with overprescribing of fluoroquinolones in small animals with direct contact to children, to families, and whatnot. And on the food animal side, we've got fluoroquinolone-resistant Salmonella. We've seen that here in Canada, actually, with fluoroquinolone use in poultry. And I often wonder what we're going to see with the rise of Salmonella species in cattle, in dairy and beef, and our rising use of fluoroquinolones in that species as well. So, even though we're not critical importance, these zoonotic pathogens, veterinary-derived pathogens, are of critical importance. And a non-veterinary example, but a bacteria that I sort of find fascinating is gonorrhea. I made the mistake of saying that I like gonorrhea in one of my last presentations, so I'm not going to say that again, but I do find gonorrhea fascinating. And as you can see, this stuff's happening right in our backyard. We've got gonorrhea cases in New Brunswick, my home province, and highlighted in yellow over here, we see that we've got gonorrhea strains that do not respond to any available antibiotics already, and that's today in 2021. So what does the future hold? Who knows? And this is just an example of how human use of antimicrobials has driven resistance, particularly in a bacteria that likes to become resistant. I like to tell people who deny antimicrobial resistance or say that it's not a thing, that every time they say that, gonorrhea just gets a little bit more resistant. So that's why we need prudent use. So why do we need prudent use guidelines? And I'm going to challenge a little bit of something that we often say in the veterinary profession, and that's that veterinarians are experts when it comes to antimicrobial use. And I want to ask, are veterinarians experts when it comes to antimicrobial use? Do we always prescribe antimicrobials when they're justified? Do we always use them properly? Do we always treat for the right duration of therapy, et cetera? And obviously the answer to that question is no. And there's a lot of reasons for that. There's huge diversity among species, among bacteria, among drug availability, among what we can use. And then we've got different disciplines, so small animal to large animal to small animal. To use myself as an example, if I switched from a large animal to a small animal clinic tomorrow, I would all of a sudden be prescribing antimicrobials as an expert, when I'm definitely not an expert when it comes to antimicrobial use in small animals. There's no way I would consider myself an expert or would even know how I should be using those things prudently. I would ideally use something like the Prudent Use Guidelines to help drive those decisions and enhance my expertise. And then we've got exotics, obviously different species, as I've said. And we've got this wonderful little human stipulation here that every person seems to like to do, and that's take their own clinical impressions over a body of evidence. So with all those going on, I like to ask, are we really experts when it comes to antimicrobial prudent use? And so I reached out to an actual expert on stewardship, Dr. Brian Lubbers, and I sort of borrowed shamelessly his little stewardship box. And he sort of breaks it down this way. He's got prevention, he's got treatment, and he's got records. And you can see prevention and treatment are only half of the picture, and records are the other half. And I would say that as veterinarians, we could probably all do a better job with our records. And this isn't just medical records. This is, diagnostic tests that we use to drive these decisions, response to therapy, all of those records that may or may not always get recorded. And then we've got prevention and treatment. And if we care about stewardship, we need to be working in this entire box, not just one of them. Now, when it comes to the Prudent Use Guidelines, obviously we're going to be working more in the treatment box, which is still important when we do get to that treatment phase. And we need to make sure that we treat things right. And so that comes down to the whole right recommendation, which is the right drug, the right dose, the right route, and the right duration. Obviously very, very important, and something that the Prudent Use Guidelines and the Firstline App really, really highlight. So I like to put things in the case perspective. So I thought I would just give you guys a case, which will ultimately lead into the demo of the guideline. Coming back to this question, are vets the experts? So I pulled this little Facebook post from the Bovine Vet Truck. It's a Facebook group for vets to discuss with other vets. In this post, we've got an ET show steer. So You would think that might be a valuable animal, an ET show steer, but it did end up with an infected castration site. Initially went on Polyflex and Nuflor. It seemed to do okay, but a week later it started looking bad. They continued Polyflex and gave Exceed. 1 week later it started running a fever. So then the vet gave Draxin. When something doesn't seem to work, we want to give a cow Draxin. And then the owner finished Polyflex, ampicillin, a beta-lactam antibiotic, and switched to penicillin, which is a beta-lactam antibiotic. So we've got 5 antibiotics into this calf, and their request for advice. The very first comment was to try a 6th antibiotic. The classical vet thing: if one doesn't work, maybe another one will work, and if 5 doesn't work, maybe a 6th one will work. I don't think sulfa is going to be the solution for this calf. Certainly this, to me, is not being an expert in antimicrobial prudent use. It's not doing any favors to that poor calf who's just wanting to be treated properly. And we've got a lot of antibiotics all of a sudden going into this one animal. So that whole situation, to me, probably could have been prevented with something like Prudent Use Guidelines. So we're going to get into how the Prudent Use Guidelines were made, how they were developed, where you can access them, and then I'll walk you through a step-by-step example of them on my little tablet. So as James mentioned, these were developed by subject matter experts. I was the subject matter expert for the dairy side, obviously, and James will show you who the other subject matter experts were a little later on. And then each subject matter expert was responsible for compiling the data with a group of consultants or a working group. And so the names on the slide here, and again, a big thank you to all these people and resources for all the information they provided. All these people were consulted when there were questions, a need for information and stuff on the Prudent Use Guidelines. So we got obviously Joyce, who was the beef subject matter expert, a lot of overlap between beef and dairy. Scott Weese, who was our canine feline, but is obviously quite knowledgeable in across all species. We got good old John Prescott, who I love to chat with anytime I can. We've got vets from the Atlantic Veterinary College, the Faculty of Medicine in St. Hyacinth, Ontario Veterinary College. We got 2 from the Public Health Agency of Canada, other industry vets as well. Jim Fairley's from the lab was also very instrumental. And for this round of the guidelines, we actually reached outside of Canada as well into our neighbors into the US and engaged Mike Apley and Brian Lubbers as well for the development of the guidelines, as well as the big scientific resources. So, there's a lot of information, a lot of input that went into these guidelines, which is very, very good, in the development of these guidelines. It's nice to have input, it's nice to have debate. And now that we're launching this app, we're opening up to everyone to have input and debate, on some of the recommendations, which you may or may not agree with. There might be different science out there and whatnot. So at the end, I'll show you how you can provide input and feedback to the SAVI group. So how are you going to access the guidelines? Well, don't forget, first of all, that you can access them still from the Canadian Veterinary Medical website. You just click on the Access CVMA Guidelines for Antimicrobial Stewardship button, and you can get to them there. For Firstline, it's available on Android and iOS phones and tablets. So you can just go to your app store, type in Firstline, and it'll come up this little colorful flower symbol. You're going to click on that, install it. You're going to open it up, and you're going to go to choose your location, and you're going to see CVMA as one of the locations. All these other ones are human hospital health networks. You can peruse them if you're interested, but obviously the one we're going to be interested in is the CVMA one. It will ask you for your email. It'll send you an access code, and once you input that access code, you're going to get to this screen here, which will allow you to access information on treatments, pathogens, different antibiotics, as you need, animal side, farm side, on a phone or a tablet. So that's how you're going to get into them. Now, hopefully this is going to work. I thought the best thing, nice example would be, let's just go through that case that I showed you. So this ET steer that ended up getting Polyflex, Nuflor, Exceed, Draxin, penicillin, and then was going to get treated with a sulfa as the 6th antibiotic. Let's find out how we should actually treat that by going through the Prudent Use Guidelines. So I'm just going to stop this one. And I'm going to do this on my tablet. So apologies if I'm hunched over on the screen, but hopefully it comes up and works. There we go. So at the bottom of the screen, you can see that little colorful flower app. That's the Firstline. So open it up and you get this screen here that you all saw on the last slide. So we've got guidelines, pathogens, antimicrobials. You know, we've got resources, search and things down at the bottom. If you go into more or settings, you can choose. So this is where you choose your location, and you can also choose your favorites. So like me, if you're a cow vet, you want to go into that and choose bovine beef and bovine dairy. That's going to put those ones at the top of the list. So you don't always have to scroll through the cat and the dog stuff every time you want to look up a disease. If you don't do this, you'll still be able to find them in the list, but it's kind of handy to have that done. Once you're finished, you go back to resources and you can decide what you want to do. But this time we're going to look at the disease, you know, that calf with the infected surgical site. So we're going to go to guidelines. This was a beef calf, so we're going to pick the system that we're dealing with. So this is skin, essentially, and that's going to give us a list of disease conditions associated with skin. If it's not there, the disease you're looking for, you may have to go back and pick another system, or you can just do a general search. But for now, we've gone into skin, and we're going to click on wound infections. So this screen is going to bring it up. It's going to bring up you know, clinical signs if they're there, so you can open that up. Pretty much everything in the app you can click on or tap on with your finger, and it's going to bring up more information. You know, so clinical signs, we've got open wound, you know, blood or pus, necrotic tissue, you know, depending on the duration of the infection. The next thing you're going to see is common pathogens. So obviously Trupperella, anaerobes, any bacteria that typically is associated with this disease is going to be there. And if there is an arrow, so not all of them have it because they're still developing the pathogen site, but if there is an arrow there, you'll be able to click on the bacteria and it will take you to an information page specifically for that type of bacteria. The other thing you're going to see is important considerations. So this is where it's going to tell you whether you should consider treatment or not, or what else you can do that may or may not involve antimicrobial therapy. So again, in this one, we see if the wound is minor, just clean it out with disinfectant. There's no need to treat that with an antimicrobial. If the wound is large, there's significant cellulitis or other complications. You know, topical antimicrobials and parenteral antimicrobials such as penicillin or tetracycline, not the 5 antimicrobials that poor vet prescribed on the vet truck. And then we get into recommended treatments. So these are the recommended treatments for this specific condition. And again, if you see the arrow, that means you can click on it. So here we've got chlortetracycline as a recommended topical treatment. So if you want to read about chlortetracycline, we can just click on it and we'll go to, you know, a general information sheet about chlortetracycline. You know, with the antimicrobial category in there, you see antimicrobial category 3 with a green stoplight system. So this one's green. You know, if we're sort of middle of the ground, like the one at the bottom, the neomycin sulfate spray, that one's going to be orange. And if it's a critically important antimicrobial or a category 1, those ones are going to be red. So let's say this one was a bad infection and we wanted to actually look up how we're going to treat cellulitis. So we go into cellulitis, it's an infected wound with cellulitis. You know, now we get much more options for our treatment, but essentially at the top, we've got our most common ones, which is penicillin, ampicillin. We can scroll through, you can see ceftiofur there, which is red. Obviously it's a category 1, and you can get through the whole list. And another nice thing at the bottom, you'll see this thing called suggested resources. So if you click on that, it'll open up pretty much a resource that you should look into if you want to find more information or where most of this information was pulled from. And so just for comparison's sake, so this was integumentary bovine beef. Just going to pull up the dairy one. So same thing, we're going to go to dairy. And you'll notice that dairy and beef are divided between calves because calves can essentially be treated as beef cows. So dairy is actually dairy animals that are greater than 20 months, or those cows who will be or are in lactation. So here we'll go to skin, you know, we'll go to wounds. You know, we'll get a lot of the same stuff, Trupperella pyogenes, anaerobes, opportunistic pathogens. Most wounds do not require antibiotic therapy. So right there at the top, important considerations. You may or may not actually have to jump to an antimicrobial to treat this condition. Recommended treatments, you know, we see got chlortetracycline, we got penicillin, ampicillin, or oxytetracycline. Obviously, these have to be approved for use in lactating dairy cattle. And then we've got duration of treatment. So, you know, there's a few things in here. Obviously, duration of treatment is something that we don't quite have a good handle on in the veterinary literature, but we're starting to develop that. And this is something that Mike Apley's pretty adamant about, is this duration of therapy. So right now it just says suggestions to treat 2 to 3 days beyond resolution of systemic signs, which is really all we can recommend, depending on the wound. But if you're not treating things for the appropriate duration, then you're not going to get them better. And so some other things about that Facebook post, some other information you want to consider. Obviously, they didn't give any dosages. They didn't say they're treating once or twice a day. They certainly didn't do any swabs or cultures to see what's in there. But in the important considerations tab, you see some good information like SID treatment should suffice. However, if it's infected with Staph aureus, you may need to treat that with bi-daily therapy. So if he was using Polyflex, you know, just once a day for Staph aureus, that may or may not have been effective, and that may have been the only change he needed to do. If he wanted to get that calf better, instead of just jumping to the next antibiotic and the next antibiotic. So that's pretty much it. For the demo, you can see all the species are in there. If we scroll down, we got canine, feline, equine, which they discussed yesterday, and the other one is poultry. Now, poultry is relatively small because this is more targeted towards the backyard poultry flocks. In the conditions that you may see as a field veterinarian, it's not really aimed at the large-scale commercial operations, which a lot of those, sort of similar to the feedlot aspect and the swine aspect, is that a lot of those are data-driven within their own system. So we can't put that data into a guideline, but we can give general recommendations as well. So again, you can go back. You can always hit the back key. One other thing I'll emphasize is you can play around with the app. There's no possible way you can screw it up. You can always close an app and reopen it or whatever. So just play around, keep clicking. And if you click too far, you can always hit the back key. So it's really, really easy to use. Very intuitive, very simple. And as of right now, full of a lot of good information, and will continue to be updated with a lot of good information as we develop the app further. Back to my PowerPoint. So we've got our good old Facebook post that said this calf should get Polyflex, Nuflor, Exceed, Draxxin, Penicillin, Sulfa. And the pugs pretty much simply said topical antimicrobials plus minus penicillin. So you can see already, you know, we could have done a lot better for antimicrobial use and for that calf just by looking these things up. As far as the future additions, this is a living guideline. So, you know, if somebody makes a recommendation on this webinar today, we can go in and change that right in the app today, and it'll be pushed out whenever the next update's pushed out, which is quite regularly. So we can always adapt this and change this as needed, which is one of the big advancements, obviously from a paper guideline, but even from our website guideline, is that we can incorporate new evidence, you know, new species. We can incorporate, if we feel like it, we can incorporate antibiogram sensitivity data. You know, as CLSI starts working and developing more veterinary breakpoints, we could incorporate those into this guideline. You know, and ultimately we may look at adapting this app for a North American approach to stewardship instead of just a Canadian approach. So essentially, with a living database and a living resource like this, you know, the future is limitless in what we can do and where we can take this. So where do you always want to send feedback? If you have any feedback, you can see my little picture there of the begging cat. You know, so this is me begging. I want everyone to use this tool. You know, as of right now, it's going to be free to veterinary members of the CVMA. It's available, it's readily accessible, and pretty simple to navigate. And please offer suggestions. You know, I always like to talk and debate science and literature, as do most of the other SMEs, so subject matter experts. So use the tool, offer suggestions. You know, if people don't use the tool, it'd be highly disappointing. I'd be highly disappointed. So you can provide feedback directly to James. You can provide feedback directly to me. Within the app, there's also a feedback tool, which James will talk about a little later on. And I'm not going to get too much into this functionality here, but if you are on the web platform of Firstline, you'll see this little thing called community, and that's just a whole discussion board that involves the antimicrobial use experts across all all the One Health aspects. So human medicine, veterinary medicine, you name it, environmental medicine. So there's a community discussion thread that you can follow on there along with different topics. And you'll see veterinary and Firstline. You can, if you want to specifically provide feedback on the app, you can do that in here as well. You know, Scott and myself are both moderators, so we'll see all of those posts. So all kinds of ways you can provide feedback as well. So with that, I'll thank everyone for their patience and their attention, and I'll turn it back to James.
Thanks very much, Murray. I'm just going to share my screen now. I see a bunch of questions have come in, some of which I'll be answering in the following slides. So bear with me. Just to give some sort of summary information about the app. Again, Murray said it's available to CVMA members. It's also available to non-CVMA members. So it's currently accessible to all Canadian vets, vet technicians, and veterinary students. I know I have questions about international access. That's being done on a case-by-case basis, but essentially the target audience at this stage is still Canadian, the Canadian vet community. As far as the treatment guidance, we currently have 5 species groups in the app: beef, companion animals, which comprises canine and feline, as well as dairy, equine, and poultry. We do have aquaculture guidelines. I know there's been a few questions about that. They're in draft format. It's essentially farmed fish at this point, not ornamental, but there are fin fish guidelines under aquaculture. We expect those to be uploaded into the app or approved within the next couple of weeks. We just need some final approvals. Small ruminants and swine as well will be following up in upcoming weeks. Again, the electronic format allows us to update and revise on an as-required basis. So if things change in the veterinary operating environment, if there's a debate about a specific recommendation, we can make those changes on the fly. As Murray pointed out, there is a feedback button on every page of the app. So if you're in any page, it also records where you're clicking the feedback button from. So if you're on a specific guideline, you hit feedback, the powers that be will see that you're on this particular page and you have feedback about that. You can also make general recommendations or suggestions through the feedback button, or you can always email us through any of the email addresses that have been shown already. It can be accessed in both Apple and Android formats at present, and currently it's only available in English. The goal is to release a French iteration in 2022. We just need to finalize the guidelines and translate. Just to provide a little more insight into the whole subject matter expertise. So again, we have 8 species groups. The first revisions took place in 2018, and you'll see that aquaculture and equine were not part of that revision because they didn't exist at that stage. But we had a number of subject matter experts who were involved in that 2018 guidelines revision. I'd like to thank all of those subject matter experts who led their teams in that effort. And you'll see in 2021, in some cases it was the same person. In some cases we had new individuals taking on that role as the lead. Each species group each expert basically decided their consultation strategy because every species group is different. So they convened working groups or they worked with their national veterinary associations. They each kind of did their own thing as far as compiling the recommended working group to develop the guidance. As far as accessing it, again, as Murray pointed out, you can install it. You can go to that particular HTML web link, or you can just go to the App Store and look for Firstline Clinical Decisions. It's important to choose the location of CVMA. That's essentially all of the animal guidelines. You'll notice there's a lot of other locations because the human side of the app is basically done by hospital, district, or location. So there's quite a few locations in there, but the CVMA applies to all the animal guidelines. You can enter your CVMA registered email address. So again, if you go to the website, the CVMA website, you don't have to be a member. If you have an email address that you registered with CVMA, essentially the password will be sent to that email address, and then the code will be, and you enter that code into the app. There's also, if you're not on the email or on the CVMA website, there is a form you can fill out through the app, and basically you put in your veterinary information as far as your location, the clinic name, et cetera, or your organization name, and then that gets approved in that capacity. All licensed vets in Canada, both CVMA members and non-members, technicians, vet students can register with the CVMA through that email address or by calling the number as well. So there's a number of ways you can access the app. Before I get into questions, I'm just going to give you a little bit of an overview of the project that's essentially providing the umbrella funding for this activity, which is SAVI, or the Stewardship of Antimicrobials by Veterinarians Initiative. The idea is to create a sustainable operating model of what we call a national veterinary AMU stewardship system, which is for veterinarians by veterinarians. And there's a whole host of reasons why we engage in this activity and why the veterinary community essentially pushed for this kind of activity, including continued access, the social license to operate, potentially addressing AMR AMU trade barriers with key markets such as Europe. Again, further developing that evidence base between AMU and AMR. And this idea that veterinarians should be involved in designing and implementing a program themselves, as opposed to having something imposed upon them from without. And again, we believe that stewardship requires sort of two sides of the same coin, this practical knowledge and guidance component to support decision-making, which essentially the guidelines provides to some extent. And we're also doing a data collection and reporting pilot as well across 3 species groups, which is beef, swine, and poultry. And if you are interested in that, you can visit savvy.vet. And the whole project is currently scheduled to end in 2023. I just want to acknowledge some of the funding support. So again, the Firstline Initiative, which is a collaboration between the University of Calgary and Firstline, but involves the Major Innovation Fund program of the Ministry of Jobs, Economy and Innovation through the AMR One Health Consortium, the Government of Alberta, and obviously match funding from the Canadian Institutes of Health Research as well. And SAVI itself, the subject matter expertise was provided through this project, through the Canadian Agricultural Partnership, CFIA, and the Government of Canada. So at this stage, I would like to open it up to questions. I know there's been a number of questions about the aquaculture side, and that will be rolled out in the near future. I know there was a comment about, I guess we would call non-antimicrobial treatments. And one of the things we did want to highlight is that that's been something that's been called for by the veterinary community, is to integrate alternative therapies or alternative approaches to antimicrobial use in with the antimicrobial treatment guidelines to provide that other perspective. And there is a place for that, as Murray had pointed out, in the important considerations part. So even before you get to the dosing information, there may be non-antimicrobial solutions to the particular issue. So that is something that's going to be incorporated and that we want to continue to incorporate in different ways as we go forward. As far as the French version be available, yeah, we're looking at 2022. It really depends on how quickly we can get the existing material translated. But that is something that we do want to do because we are a national organization, and obviously veterinarians in this country speak both English and French. But yeah, I invite anyone to ask any additional questions, in the chat function, either for Murray or for myself, and I would be happy to respond to them. And I know different people have different typing speeds, so I'll give you a few seconds to put something in there. But if you do have any comments, questions, feel free to provide them. Well, that's okay. We already had a number of questions already. If that is the case, again, if you do have any questions or suggestions, you do have to, you feel free to send suggestions in to us. We do have a question from Larry Hamill, which of course we know very well. How are the recommendations finalized? Do they rely on a panel that gathers evidence, looks for meta-analysis? Right now, we're just dealing with subject matter expert opinion, and that's essentially how it's conducted. And the format of that is really up to the subject matter expert, who is the lead. So as far as the actual finalization of that process, it's essentially conducted according to sort of the existing structure of what the subject matter experts set up. So there's nothing systematic about it at this stage. There are limits to the resources available for this project and this initiative. But it is something we want to consider over the long term in terms of how to maintain that that credibility and that the evidence base by which to substantiate the recommendations. I don't know if you have a comment on that either, Murray, but
yeah, I mean, that's it. The subject matter expert's responsible for, for gathering other external expert opinions, and every evidence that they can find. If there's a meta-analysis, that's great. Oftentimes, there isn't a meta-analysis, and I can give a little example that when we had the discussion around duration of therapy for listeriosis recommendation, Mike Apley actually asked, where did you get that recommendation for duration of therapy? And the recommendation actually came from him, and he didn't even remember making that recommendation. So, so duration of therapy and a lot of those things don't actually have a lot of that hard data behind the meta-analysis and whatever. So we just gather what we can, and then we make, you know, an evidence-based decision based on the evidence that we have, whether that's limited or extreme, depends on the specific topic that we're trying to focus on.
John Conley has a question about the update process in terms of what will it be the process and how often. Historically, I guess we've done sort of major revisions every few years, at least dating back to 2018. We did another one in 2021. Those are major revisions where we added considerable heft to the guidelines in terms of adding additional fields, adding additional types of information, and that requires a fair amount of diligent work on the part of our experts. When it comes to more of the day-to-day updating of the information, we hope that that's something that can be done on an as-required basis, as an ongoing basis. The app itself is very easy to make changes to. I guess the real question is who's responsible for sort of overseeing that process. It is a bit challenging because we have many different species, and each species is oriented a little bit differently. We were in consultation with national veterinary species groups for each of the species in terms of getting their buy-in in terms of basically identifying an individual to serve as sort of a steward of that particular guideline for that species for some specific period of time. Those negotiations haven't completed yet. So we're basically working sort of ad hocly with the existing authors at this point. And again, if anyone has any kind of questions or new information regarding any of the guidelines that's in there, there's all kinds of ways for them to provide that information or give feedback that maybe something should be reconsidered or debated. And that's the whole purpose of this type of resources that allows changes to be made and encourages debate about what's in there. So this is certainly not a finished product. We see it as an evergreen product that will be constantly updated. But when it comes to major, I guess I'd call them major additions or systematic structural changes to the app, that's something that will probably be several years before we make any kind of huge changes like that. Another question we have is from Lucy Verdon about collecting data about which sections are in use the most. And yes, that is a huge advantage of the app where specific guidelines, page views can essentially be tracked. We can find out which guidelines are being reviewed the most, what information is being used the most. It'd be a sort of maybe a form of syndromic surveillance, but ultimately it does provide some insight into which sections, which animals, which species, which systems get accessed the most. We'll be linking in with CASSH on emerging resistance. I probably need a little bit of what is CA? I'm thinking of CAS, but what is the Canadian
Animal Health Surveillance System? Yeah.
No, I don't know if that's it. If someone can provide, someone probably knows what CASSH stands for, but I'm not quite sure. But is it? But I'm basically asking if we're linking in any way to CASSH in terms of emerging resistance in some diseases or areas. I haven't been on that. We haven't talked about that yet at this stage. Are we planning to add real-time data collection and then sort of antimicrobial use? So the other aspect of this project is around data collection. We are collecting prototype data from a number of data providers. The challenge being, like with any data collection project within the sphere, there are proprietary issues, there are confidentiality issues, and there are sort of veterinary client privilege issues where, at least as far as CPARS is concerned, in terms of collecting antimicrobial use, antimicrobial resistance data, you need a large enough sample to essentially be able to aggregate it and anonymize the data. If we can reach that point where we're able to produce enough data so as to not infringe on that sort of competitiveness, yes, we would like to link that in with the guidance as well and provide some degree of information on what's being used. But again, there are certain restrictions on how we can do that. As far as essentially we have a voluntary program, and so there are some restrictions on the kind of information we're able to share. When do we see the addition of swine or other species? So swine, again, is in draft format. It really just needs to be approved. And so the 2018 swine guidelines were developed by Christian Klopfenstein. There's a sort of a revision has taken place. And so we expect those guidelines to come out probably in the next upcoming weeks or maybe months, depending on how long it takes to approve all the guidelines. But it won't be that long until the swine guidelines are added as well. Any comments on my terrible answers, perhaps, to some of your questions? Again, if someone wants to provide a little bit more information on what the CASSH is, I'd be happy to take that down as a suggestion. Otherwise, any other questions, comments, or suggestions?
I'll make a few points to some of the things I've seen
Sure.
in the chat, James, while we're waiting for more to come in. Yeah, I thought it was CADS, the Canadian Animal Health Surveillance System. Yeah. Henry asked about things like sodium iodide. And so sodium iodide used to be labeled in Canada. There was a product, Vetoquinol actually had it, but it's since been gone. So there are alternative therapies and stuff that we decided not to include in there, mostly because you know, we couldn't possibly generate accurate dosing and withhold times for all of those things. So if you're looking for that information, Henry, on the Lumpy Jaw site, under the successful treatment tab, it talks about successful treatment often involving concurrent therapy with antibiotics, sodium iodide, and anti-inflammatories. What dose of sodium iodide you use, you have to derive from the literature. And then one thing I didn't mention actually, which was probably important to cover, is that anytime there's extra label drug use of approved products in this app, there's a link to the CG Ferret recommendation site. So we really want to encourage veterinarians, when they have to use products off label, to take that next step and submit that to CG Ferret to generate a proper withhold time for those things, because on the food animal side, obviously withhold time is a very important consideration, where they don't have to consider that so much on the small animal side. And another point I wanted to make is it's nice to consider what this app is, which is you know, prudent use and treatment guidelines. But don't forget what the app is not. And the app is not an entire guideline, an entire, you know, hand-holding on how veterinarians should treat every case. You know, they're supposed to learn that in schools. They're supposed to learn that at CE events, you know, and they're supposed to learn that, you know, through discussions with their mentors and whatnot. We couldn't possibly design an app that would take, you know, every vet through a step-by-step approach of how they should deal with a case. So going back to that infected calf, for example, and it's just an example, you know, of how veterinarians can get down the path of just throwing antibiotics at something when they may or may not be indicated as far as prudent use, but how you should actually manage a case of a calf with an infected surgical site. We couldn't put all of that into the app. We can give a few tips here and there, you know, flush it, drain it, do whatever. But if we did all that, we'd essentially be rewriting a textbook, and we don't need to do that, because there's lots of great textbooks out there, which a lot of people on this call and a lot of the people from the working group contributed to those textbooks. So this is a treatment guideline app. It's not an overall everything encompassing app. So the last comment is things like metaphylaxis. They are in there. There's guidance on metaphylaxis. However, most of the metaphylaxis, particularly in the feedlot side, again, as I said, is driven by data that's generated by, you know, the veterinary companies and whatnot that are dealing with those feedlots and working with those large operations. For this app, we couldn't possibly put in metaphylaxis recommendations that may or may not go against the data, you know, generated by these feedlot companies and stuff. So it was pretty tricky there on that side. But metaphylaxis is discussed, but we can't give full guidance around metaphylaxis. So prudent use guidelines, they are for when the decision has been made to treat an animal with an antimicrobial, and then how they should go about that, you know, following the evidence, instead of, in the case of the calf, just throwing the next antibiotic at it and hoping that that's going to make a difference.
Thanks, Murray. Any other comments or questions? We're 45 minutes in, and I just want to give everyone an opportunity to make a comment or a question or a suggestion. We really thank you for what you've provided so far. It's been a good experience for us to hear from you. And again, if you have anything to say is important, or whatever you think, feel free to do so. Okay, well, I think, oh, yeah, okay, yeah, perfect, thank you. Some nice comments. So ultimately, this is not the end, this is just the beginning from where we're sitting. This is basically just an introduction to the app. We hope that you download it, we hope that you try it out, that you use it, that you tell people about it, and that you provide your feedback, either positive or negative. We're constantly looking to improve the app and the information within. And ultimately, you're part of this expert group now too, as of Canadian veterinary community, and so we look to your input. If you have some ideas, we're certainly willing to consider them. And again, stay tuned for the additional species that we rolled out in upcoming weeks and months. And again, thanks so much for your time, and thanks to Murray for his excellent presentation. And I wish you all a very nice day and a very nice weekend going forward. So thank you very much.